rise.
In the matter of a child.
We are here on a matter of extreme urgency, of life and death. Time is of the essence. Please bear this in mind and speak briefly and to the point. Mr. Berner.
I shall indeed be brief, my lady. The applicant in the matter is the Edith Francis Hospital, Wandsworth, which is seeking the leave of this court to treat a teenager, Adam. He's 17 years and 9 months. He first experienced stomach pains at school.
I've read the papers, Mr. Berner.
My lady, I believe all parties accept that Adam has leukemia. The hospital wishes to treat him with 4 drugs, a universally recognized therapy, as I can show.
No need.
Thank you, my lady. 2 of these drugs have the side effect of attacking the bone marrow, compromising the body's immune system. Therefore, it's standard to transfuse during treatment. However, the boy and his parents are Jehovah's Witnesses, and it's contrary to their faith to accept blood products into their system. This apart, Adam and his parents agree to any treatment the hospital can offer. At this point, I'd like to call the consultant hematologist.
Fine.
Professor Carter, can you bring us up to date on Adam's condition?
Well, it's not good. He's weak. And as I'd expect, he's beginning to show the first signs of breathlessness. His hemoglobin counts are dropping steadily. The norm is 12.5. This morning, it was 4.5.
And the white cell count?
Well, they should be somewhere between 5 and 9. He was showing 1.7. As for the platelets...
Remind me of their function?
They're necessary for clotting, my lady. The norm is 250. Adam's count this morning was 34. A healthy adolescent produces 500 billion blood cells every day. Adam is producing no blood at all.
And if you could transfuse this patient?
Then he would stand a decent chance.
Have you discussed with Adam what will happen to him if he's not transfused?
Well, I've spared him the details. He knows he could die.
What knowledge does he have of the manner of his death?
Nothing at all.
Then perhaps you could tell us?
It'll be very distressing for everyone, including the medical team. They simply can't understand why they should risk losing this patient. He'll fight to breathe, and he's bound to lose. It'll be frightening, like drowning. Before that, there will be internal bleeding, perhaps renal failure. Some patients lose their sight. He may have a stroke. Patients vary. The one sure thing is that it will be a horrible death.
Do you agree, Professor, that the freedom of choice in medical treatment is a fundamental human right?
In adults, yes, I agree.
And Adam is very close to being an adult.
If his 18th birthday were tomorrow morning, he wouldn't legally be an adult this afternoon.
I think we can agree that Adam is very nearly an adult. And isn't it the case that he's expressed his views to you intelligently?
His views are his parents' views. His objections to blood transfusion are the doctrines of a religious cult for which he's likely to become a pointless martyr.
You took the oath. I assume you're a Christian?
I am an Anglican.
Is the Church of England a cult? Are you aware that the World Health Organization estimates that up to 20% of new AIDS cases are caused by blood transfusions? And transfusion brings other dangers. Hepatitis, Lyme disease, malaria, syphilis, Chagas disease, graft versus host disease, transfusion-related lung disease, variant CJD.
Very rarely happens, and never under me.
So if we added up all the dangers, wouldn't you say there was enough to give a rational person pause?
The blood products we use are tested to the highest standard.
But it wouldn't be unreasonable, surely, given all the potential for infection and error for a patient to insist his consent be sought.
You're playing with words. If I'm not allowed to transfuse this boy, we may lose him.
Jehovah's Witnesses patients are often treated now by what's called bloodless surgery.
Look, we're not dealing with surgery here. This boy needs blood because his treatment prevents him making any of his own. It's as simple as that.
Thank you, Professor.
Thank you for your time, Professor Carter. We'll take a break. 20 minutes.
Court rise.